Recurrent IVF failure is a very distressing condition for the couples undergoing this particular procedure. Already there is a stress of not being able to conceive, and after undergoing this tedious, financially and psychologically draining process, negative results even make them weak. There are a couple of things that can be analyzed in the previous IVF cycle that can help us to prepare ourselves before undertaking a next step in IVF. A lot of times couple would come to me with 2 cycles failure or 3 cycle failure. What becomes important to me is to know the facts that what were the injections that were used in the previous cycle, how was the quality of eggs that were obtained, what was the quality of the semen sample that was used, what was the quality of the embryos that were so formed, and what were the quality of the embryos that was transferred. Also, the thickness of the lining and the character of the lining becomes important. All these things are measured by a subjective scale, as in it is the subjective experience of the embryologist and the clinician. Despite having all the parameters in the optimal level, still sometimes the IVF cycle may fail. What extra can we do in the subsequent cycle to improvise the chances of one getting pregnant? We can use the technique of endometrial scratching, wherein we would just place a catheter and scratch the lining of the uterus so as to improvise the chance of getting pregnant before starting the next cycle. We can do a hysteroscopy, which is putting in a camera and visualizing the lining of the uterus and seeing if there is any abnormality with the lining, and simultaneously taking biopsies and sending them for testing so as to find if there is any cause that can be found out. Also, we can suggest to such couples time-lapse imaging and pre-implantation genetic screening. Time-lapse imaging is a technique that helps us to choose the best of the embryos that have been so formed. Although the embryos may look all A grade and are randomly chosen, but with the time-lapse imaging we can have a look at the 24/7 video recording of how such embryos have reached that particular stage. This recording and observing the division pattern or the growth of the embryo in the lab helps us to choose which particular embryo has the maximum implantation potential. This technique also aids in improvising the chances of getting pregnant. Pre-implantation genetic screening is taking an embryo biopsy. Once the embryo is formed, 1 or 2 cells are extracted from it and they are sent for genetic analysis. Only a genetically normal report will tell us that this particular embryo is genetically normal and hence have better chances of getting pregnant. So we choose the genetically normal embryo and transfer them in the same or in the subsequent cycle after preparing the lining of the uterus artificially.